Hi, this is Kirk, the bariatric carnivore. Well, I think you need to understand a little bit more about the why. And if you understand why you are making certain changes, I think the better off you're going to be in the long run. Too many of us want to find some guru that is going to give us a recipe list and do these exercises, and that is going to be our secret to health. And it doesn't quite work that way. Number one, it doesn't work as far as motivation is concerned, because it is so easy to do a Weight Watchers type of program where I'm following their recipe list, etc., and then just say, oh, the heck with it, I've got, this event coming up, I'm traveling, fall off the wagon. And, even when you're paying for it from some influencer or some guru, some health coach, it's still darn difficult to really stick with a program unless you understand the why. You need to understand the importance of metabolic health. Now, does that mean that you need to have a PhD level understanding of the Krebs cycle, or some other? Do you need to understand the in-depth cellular biology and how mitochondria work and all that type of stuff? No, but you need to understand a little bit about how metabolic health works and why you need more protein as you get older, because your muscles need it and you're not as good at doing things. And understanding how insulin and increasing your carbs is going to affect your insulin levels and blood glucose, and why this creates a horrible cascade of inflammation in your body. It doesn't require a PhD level understanding of it, but boy, once you understand it, you start to figure out just why that, you start to figure out the why. And you start to figure out just what it takes to be healthy in the long run. It's not rocket science, but boy, it's important to understand. And once you start figuring this stuff out, you're going to realize that there's a lot of really good people out there making YouTube videos from a wide variety of sources. And one of the ways you get that, this whole thing works, by the way, is because people like you hit the like, subscribe, make comments, and share these type of videos. And that's what helps create a bigger audience and allows YouTube to know that these things are valuable and share that information. There's some people out there that I have been paying attention to for a long time, and I really suggest you take a look at their videos. Dr. Sean Baker was the guy who wrote the book on the carnivore diet and has a great YouTube channel. He's also got a very good company called Rivero, which will work with you one-on-one to help you take care of very specific health problems. And then there's Dr. Ken Berry, who is now working on the American Diabetes Society, and he has a great channel and tons of viewers and a great community of people that are really making a difference. And then there's some people like Dr. Ben Bickman, who is a scientist over at BYU, who really does a great job of explaining insulin resistance, and that has been his main focus of his work for years. And he does a great job of explaining how this all works and why it is so important to your overall health. And people like Dr. Ford Brewer, who runs a channel called PrevMed, where he talks about a lot of the other conditions that, and he also has consultative practices that help people to get healthy. He's not exactly part of the low carb community, but he is definitely one of the people that I listen to as far as working to improve my overall health. And this is just scratching the surface. You got people like Dr. Michael Eads, who has this great newsletter that he puts out each week called The Arrow, that I just devour every week because he does cover so many different areas. He wrote the book Protein Power years ago, and is now working to update it, where he talks about a lot of the very things that I talk about on this channel. And any book from Gary Taubes, who's a journalist, but he really explains what's been going on in the background as far as science is concerned. And these are things that you can look at and pay attention to to really take control of your health. I mean, there's a lot of great information available at virtually no cost that will give you more information than probably even your own doctor has, because, you know, unfortunately, the way medicine is it's siloed. Your doctor does not receive any real training on how to make you healthy. They are into disease management. All the different specialties have been siloed, where your heart doctor is not paying any attention to type 2 diabetes, which is the #1 risk factor for heart disease, because that's not his specialty. All they care about is lipidology and trying to get your cholesterol level down, but they're not looking at the inflammation factors. And I'm not saying that I'm against doctors. The best you can do with a doctor, though, is, you know, when you've got a specific condition and they've diagnosed it, you've got to research it on your own and figure out what's going to work for you and bring them information. Because really, frankly, a relationship with your doctor, the term doctor really means teacher. And any good teacher knows that you learn as much from your students as they do from you. And it should be a symbiotic relationship. You should be working with them and they should be working with you. And you should be learning from each other if it's going to work. And if you don't have a local doctor, you know, look, frankly, we now live in a time with telemedicine where you can reach out to experts all over the planet, and for a very modest fee, you can get 15 minutes to talk about your specific case. And that's the beauty of where we are now, where we can have that type of interaction with one another. And you can learn to get healthy, and we do need to learn to get healthy, because frankly, we are in bad shape as a country. Nearly 90%, by some estimates, of Americans are metabolically unhealthy. They've got problems and they've got inflammation. Some states, 60% of the population is obese, not just overweight, but obese, which means they are chronically inflamed, creating other cascade of problems. And then it's estimated that over half of America is type 2 diabetic or pre-type 2 diabetic, which means they basically are having all the same problems. They're setting themselves up for the leg amputations, the blindness, and everything else that comes with type 2 diabetes. The only way to, and the system isn't going to fix it. You've got to do it yourself. And that's the challenge, but also the hope, because we do have the tools now to make that happen. You don't have to just rely on whatever the news media tells you, but instead you can go off and figure this stuff out for yourself. And frankly, you do need to understand how this works, at least at a basic level, so that you do have the motivation in the long run to stick with it. Because it's not easy to say no to all the junk food. It's frankly cheaper in the short term to eat junk food and ultra-processed food than it is to eat real food. But when you look at the cost of that to your health overall, you realize, no, it's actually, that Hostess treat is actually much more expensive than just the package price. So hopefully this will give you some food for thought. If you like this message, please hit the like and subscribe. Join this community with other like-minded folks who are trying to make a difference and to get healthier. We don't need more frail people in this country. I try to put out a couple messages each week. I will talk to you again soon.